Today I'm joined by Zulfi Buttha, the ambassador of the International Pediatric Association. He's here to talk to us about maternal and child health and his expertise in global health. And we have one question for him, and he has an answer that is going to be very provocative and thought-provoking. How do we make sure children and adolescents not only survive this crisis but thrive and potentially transform by the end of this?
So to answer this, you have to have some historical context. This is one pandemic which is unusual when you look back at the history of global pandemics, in that it does not kill children in the same proportions as it kills adults. But we are very concerned that in terms of long-term benefits or long-term harms, that this pandemic has the potential of doing tremendous damage to children and families, just by the nature of the severity of the illness. First concern is around the effects on immediate preventive pediatric services. Children who would otherwise be getting vaccines but can no longer get vaccines because they're unable to pay a visit to a well baby clinic, or children who have other health needs but cannot get it because they are now sequestered. And both of those are very important areas on which we are actively collecting data. The third area where I don't think we have enough information right now, because we haven't had something like this happen more recently, is the impact of the situation on schooling and education. So we talk about as if telemedicine, teleeducation is the panacea and everybody's going to have access to it. That's the great divide also, because the vast majority of young children, young adolescents in low and middle income countries do not carry cell phones, do not have access to that interface. So my and my colleagues' big worry is also the impact that this disease, this illness, is beginning to have on global economies in such a way that sometimes when you cross a particular threshold of recession, you just don't have, you just can't spend your way out of it, so to say. So we have to find innovative mechanisms of making sure that these children who are at home and out of schools do not suffer because of the lack of that educational opportunity and contact, and also that we find a way of minimizing that closure by catching up on the curriculum later on in the year once children return to schools. So what may happen at the end of this pandemic is there hope that our women and children, mothers and children and adolescents may come out with some lessons and maybe some degree of resilience. The answer to that is yes, there is great opportunity, and that's why this kind of discussion and dialogue is so important. So we need this time to fix our health system. I mean, I smile to myself because it's not just the US that we've been involved in or Canada, but a substantial amount of my work is also in low and middle income countries. And I'm a neonatologist by training. Very few people recognize that we lose close to around 1.25 million newborn babies every year because they're just born in such difficult circumstances, either premature or other complications. I'm not even talking about those babies who have birth asphyxia and require all kinds of support. So let's assume that this middle group is a reasonable one. You're born prematurely, you're born small, you require respiratory support, facility-based care. These numbers that I've just given you of babies who die typically die because the system, the critical care system, the ventilators that you need to support them are not there. Now, in many low and middle income countries, there is a scramble to buy ventilators without recognizing that these ventilators ought to be there for routine care for many conditions also. So one concern that we have is that if the world hasn't recognized so far that health systems need to be better prepared, then this is the opportunity to fix not just the COVID infections, which is the dominant source and cause of illness and infection, serious infections, but this is also a clear opportunity for looking at routine services for children who need them and how to make them available. So people are all of a sudden beginning to recognize the deficits in health systems in difficult to reach populations. So I hope as we get out of this crisis, countries will look at investments that they need for their own security, national security, health security. And those investments have got to be into very smoothly running functional primary healthcare systems, and also a transport chain that allows you to access and go to secondary hospitals. So, I mean, those silver linings are what gives us hope that we may come out of this as better people, better places of residence, better planet, reduction in consumption, respect for ecology, sustainable growth, so on and so forth. So I think we can certainly achieve some of those which will benefit not only the COVID response, but also life after COVID.
Thank you. And, what sort of government policies are you thinking need to be put in place then, to deal with the emergency, but then also to continue the sort of care that you're calling for, that, that is necessary just to prevent, the newborn and maternal deaths that you're talking about that happen regardless?
So I think one policy the governments have got to look at is their epidemic preparedness policy. So, this caught us flat-footed, this caught us unawares, this caught us not having even learned from the example of Ebola. The only country where I have seen a measured response with some tacit knowledge and experience of handling these kind of outbreaks was, Canada, where they had the SARS-like experience before, and therefore they were able to put protocols in place. South Korea, they had the MERS outbreak a few years ago, which killed so many South Koreans. Again, so many as in, a couple of dozens, but not the thousands and tens of thousands that we are beginning to see now. These countries do offer us an example as to how one could potentially put elements and policies in place that are able to reduce the risk, the inherent risk in anyone's hands, and that we will, moving forward, have resilient health systems. So health systems which can, when stressed, accommodate a larger number of people, but when those stresses are eliminated and there is some physiological health benefits, a package that's available to people, that we would rapidly develop those safety nets that we need to have within populations.
Great. And wanted to touch on any sort of resources that the IPA has to offer to advocates or, pediatricians or whatever sort of tools you have that you think are useful.
So that's a fantastic question and a very important one. So in IPA, we've done several things. So I've been involved with John Klein in leading an IPA position statement or guideline document for pediatricians and pediatric societies worldwide that includes newborn, some elements of maternal, newborn, child, and adolescent health risks and responses. So that will be published within the next 3 or 4 days in the archives. It's an open access guidance, and we will, after discussion with UNICEF and UNFPA folks, begun to put a system in place for us to have these regular webinars for education and for capacity development. The other thing that IPA is doing is also producing learning materials. So we are very rapidly producing slide decks and some self-learning materials that will be placed in an open access space, whereby you can have very specific guidance around issues like immunization, breastfeeding. Should a mother who's COVID positive breastfeed a child? Can she provide kangaroo care? Can she interact with the baby like all normal mothers would? So these guidance documents or policy briefs are going to be ready within the next 1 month. And hopefully, at least this will allay many of the anxieties in the first world.
Great. We'll provide a link to the IPA website, which is where people will be able to find the updated materials. Is that correct? Yeah.
Yes.
Okay. Well, thank you so much for taking the time to share your thoughts with us and give us a couple of silver linings and also point us towards some tools that will be useful for people.
Thank you very much for having me.